Hey YouTube, it's Dr. Daniel Kaplan. I'm back again with another video. And today we're going to talk all about hallucinogens and hallucinogen use disorder. Before we get started, I'd like to give the lay of the land. In reality, there are two subtypes of hallucinogen disorders, but we're going to collapse them together. We're going to talk about what hallucinogens do during intoxication. We'll talk about hallucinogen use disorders, and then we'll talk about the relative prevalence within society. So if you like what you have to hear, click the like button, subscribe, click the notifications tab, and that will allow me to bring this video to a larger audience. Well, without further ado, let's talk about hallucinogens. So the first thing I want to say is that hallucinogens in general provide very powerful changes in one's sensations and perceptions. You might hear this described as a trip or tripping. These are the terms for when you're intoxicated. Now, hallucinogens come in different forms. There are the naturally occurring hallucinogens, things like mescaline and psilocybin. And then there are the lab-produced hallucinogens, things like LSD and ecstasy. So it's important to understand that if we were going to diagnose a person with a hallucinogen use disorder, there are two real disorders that we could give. We can give a Phencyclidine use disorder, or a PCP-based use disorder, or an other hallucinogen use disorder. Now, in reality, the phencyclidines are a separate category, but because the symptoms are the same, I personally collapse them to save a little bit of time. So you might hear the term PCP or angel dust, ketamine, cyclohexamine, diazoxycholinesterase or MK801, forgive me tripping on that word. These are your phencyclidine use disorders. However, the other hallucinogens include things like mescaline, DOM, ecstasy, shrooms, DMT, LSD, and morning glory seeds. So there are different categories, and in the DSM, we would specify which one it would be in. Now, the general criteria I said is the same. So in criterion A, you need that 12-month period where you have clinical distress that we're tracking your use of a hallucinogen or phencyclidine. The hallucinogen, now, in all fairness, you only need 2 of these symptoms. Many people have much more. So, but let's go through them all. You need to take this drug in increasing quantities over a period of time. Attempts to cut down are unsuccessful. You wind up spending a lot of activity trying to secure the drug. You have craving for the drug. It interferes with your ability to perform a major role obligation. You continue to use the drug despite it causing you problems in social and interpersonal relationships. You use the drug in a situation that it could be physically hazardous, or despite the fact that it has caused psychological problems, you disregard that, or despite the fact that it exacerbates some kind of problem, you disregard it and continue to use. So those are the criterion A. You only need 2. Now, mild hallucinogen use disorder is going to be 2 to 3 symptoms. Moderate is going to be 4 to 5 symptoms. And severe is going to be 6+. When it comes to other aspects, we do talk about tolerance. We cannot talk as much about withdrawal. I'll explain that in a minute. So tolerance is, by definition, either you need more of a drug to get a certain high, or if you use the same amount of drug, you get a lower high than previous. Now, hallucinogen use disorders include tolerance. But when it comes to withdrawal, the withdrawal features of hallucinogens are not well defined. Therefore, unlike many of the other disorders, that is kind of set to the side. So I mentioned the severity. We could also have a condition that's in remission. So a person, let's say they used LSD for 12 months and it impaired their function, this, that, or another, and then they stop. So if they stopped for 3 months, then they're in early remission. And early remission goes from 3 months all the way to 12 months. Once you hit 12 months or 1 year, we refer to that as sustained remission. Now, your remission can occur due to your voluntary choice, or it can occur due to being in a controlled environment, which prevents access to the drug. So what are some of the features? We're going to talk a little bit about LSD. LSD is one of the most powerful hallucinogens. So I put a spotlight on this, but we very well could have talked about ecstasy or any other one. So if a person takes LSD, they're going to be put in a state of hallucinogen intoxication, or what we call hallucinosis, right? So this is going to alter their sensory perception, and it could lead to hallucinations. And in some cases, you can get synesthesia. Now, synesthesia is a cool phenomenon where you have crossing of the senses. So you could hear colors or see sound. Now, obviously, that's not what's really going on, but under the influence of a hallucinogen, you can have a crossing of the senses. Now, how does LSD work? It works similar to many of the hallucinogens, that LSD binds to serotonin receptors. And because it binds to serotonin receptors, it usually has this heightened emotionality, feeling connected to the universe, so to speak. And then obviously, when one is coming off of it, they might have a depression crash because serotonin is linked to depression. So what percent of people would you say have used hallucinogens in their life? 1 in 7. 1 in 7 Americans have used a hallucinogen at one point of their life. Now, we talked about tolerance and withdrawal. Unlike things like cocaine and heroin, which have very strong tolerance and withdrawal effects, the tolerance and withdrawal is rarer now. But they do pose danger. Just because you don't have tolerance and withdrawal to the same degree, you can have a bad trip, which is a person who has very unpleasant or very extreme negative emotional reactions, and that causes emotional disturbance. So that does happen from time to time, and there's no rhyme or reason why it happens. So that is a legitimate risk. And we also have another danger of flashback. So a flashback can bring you back into a trip you previously had, and that could occur days or months later, even after the drug use. So that's pretty remarkable. We also have something called a hallucinogen-induced psychotic disorder, which is where the use of these hallucinogens induce more severe psychotic states. So that is hallucinogens in a nutshell. I will dispel one myth before I finish. How many, let's say, tabs of acid do you need to take to be considered clinically insane? You're going to hear a whole bunch of numbers, but there's no real number. Any number you hear, 6 tabs or 5 tabs or whatever it is, different trips makes you insane, it's not true. You, in theory, could take hundreds of tabs throughout your life and never be considered clinically insane. Or you can have, as I mentioned, a hallucinogen-induced psychotic disorder, from your first time. So we have to be very careful with the mythology around each of these drugs. One more thing, we are seeing a push for the legalization of hallucinogens, similar to cannabis. We're seeing some medicinal value. And in the case of trauma, micro doses of hallucinogens might be helpful. So in a nutshell, that's hallucinogens. You should be able to understand how long intoxication takes. You should be able to understand how to diagnose PCP-related hallucinogen-based disorder or a non-PCP-related hallucinogen disorder. You should be able to determine the severity of a condition, and then you should be able to know the frequency by which it occurs within society. I hope this video was helpful. It's part of a larger series on mental health. Click the like button, subscribe, click the notifications tab if you found this meaningful. And of course, if you have any questions or comments, please put them in the comment section below. I read and respond to every comment. Until next time, take care, everybody.